everybody. Hope you all are doing well. Welcome to my weekly Facebook Live. This is Dr. Patel here, Dr. Shounuck Patel from the Center for Functional Regeneration here to talk today about low back arthritis. So as we get started, if you have any questions, concerns, comments, then please comment. If I don't see your comment during the show, then I will be certainly responding back afterwards. And if you have any questions about your particular condition, please feel free to comment, DM, or email us at info@fxregencenter.com. So, today I'm going to be talking about arthritis of the low back. If you've been joining us for the last few sessions here, we've been talking about various different things in the low back. We've been talking about disc degeneration, disc tears, disc bulges, but one thing that oftentimes is associated with back pain that we haven't really discussed yet is arthritis in the low back. So what is arthritis? How does it happen? Is it always something that causes pain? And what are the issues that are associated with it? So today I'm going to go over first a little bit about the anatomy again. I've done this before, but I want to just make sure that we're all on the same page, because before, when I was looking at anatomy, I was kind of drawing things out for you and showing things on MRI. Today I wanted to show you this X-ray here. So on X-ray, when we look at this is a side view of the spine. This is the front of the body, this is the back of the body, this is the top, this is the bottom. And these squares are the vertebral bodies, the bones. In between these bones, there are discs, which you can't see on X-ray. X-ray is really good at looking at bones. It is not so great at looking at soft tissue structures. In the back here, these are what are called the facet joints. And basically, I'll show you what that looks like. I did some pre-drawing today, so you're going to have to deal with that. Let's see how that goes. Over here, you see the blue outline kind of outlining the spine segments here. And you see that outline actually goes all the way out to over here. This is that spinous process, that nubbin that we feel when we press the back of our spine is back here. And again, what we don't see in this is our disc. So over here, I've kind of outlined what the disc looks like right there. And then back here is what's called the facet joint. Okay. Now, what happens when we start to develop arthritis? Well, let's take a step back and look at what's the natural history of the spine in general. One thing that we've discussed in the past is what happens with the disc. So I mentioned before in the past that the disc is like a water balloon completely filled with jelly. When we're teenagers or younger, it's completely filled, so it's nice and cushiony. And as we start to get a little older, there's a little bit of dehydration that occurs in the disc. So ultimately, instead of being nice and cushiony, it starts to get a little bit more wobbly. And as that friction takes place, as there's motion that starts to take place at that disc level, what happens is that the facet joint starts to rub, right? Gently starts to rub. As there's that increased friction that takes place into the facet joint, particularly if we're not moving the way that we should be moving, right? As that friction takes place into the facet joint, the smooth cartilage surface starts to wear away and the bone starts to get a little bit rougher. In actuality, in the low back, the orientation of the facet joints actually changes. So whereas they're kind of in this position, they start to actually get more, if you're looking front to back here, they actually start to change in position a little bit in order to allow for that motion to be taking place. Now, what's not in this diagram right now that we don't really appreciate yet is is what occurs with what are called the ligaments, right? And again, I've mentioned this in the past before, but I'll go through it again. The ligaments are these soft tissue structures that really connect bone to bone. So we have those ligaments connecting the spinous processes. We have those ligaments between the spinous processes here. We have the ligaments connecting the back of the vertebral bodies, the front of the vertebral bodies. We have those ligaments connecting the facet joints, right? And those are what are called facet capsules. And we have ligaments that are bordering the back end of the spinal canal, right? And just so you can picture it, this right here is where the nerves are traveling in our low back, and then the nerves exit out of this central canal and go down our legs in different distributions. Got it? So when we're looking at that, these ligament structures, these grayish whitish structures that I just drew in, these are essentially, I've mentioned this before, like those thick rubber bands that surround broccoli in the grocery store, right? They're strong, they're supportive, but there's some stretch to them. Now, if you could imagine that if this disc is actually starting to get a little bit more wobbly, and there's some motion that's taking place between these vertebral bodies, then as that motion takes place, these ligaments over here are going to start to get stretched, right? These ligaments will start to get stretched in different ways, and as that stretching occurs, there ends up being more friction, more motion into those facet joints. So as there's that continued friction and motion, well, the bone is going to react. Arthritis is caused by the joint reacting to excess friction or pressure. As there's motion that takes place there, especially if there is excess motion, the bone is then going to react. Now, when we think about the spine, and we think about bones in general, we're always thinking kind of in lines of like those skeleton models that we see, like the one behind me on that side over there, right? But those models are static. Those models are not living, and those models are not constantly changing to the environment that's around them, whereas our bones are actually living things. And the bone turns over, the bone changes, the bone reacts to the environment that it's in. So as there's more pressure onto the area, the bone's gonna be like, hey, there's a lot of pressure on me. I gotta bulk up in order to accommodate that extra pressure that's being placed on me. Or as there's more friction and more instability, more motion there, the bone's gonna be like, hey, I have to actually do something in order to help provide stability where I do not have it. So the bone actually starts to create what's called bone spurs. Now, a bone spur is actually just a growth of bone that's, again, reacting to the excess friction that's there. And I'll show you a little bit about what that looks like in a second here. But if you could picture this, now I'm going to kind of scan down to this lower area over here. If you could picture this friction that's occurring, then what's going to end up happening is this. This bone here, as there's movement that's taking place, the bone is actually going to start to spike in different ways. It's going to start to get a little rougher, right? And that is essentially what happens with arthritis, okay? As that all gets rougher, there's going to be some breakdown of the cartilage, breakdown of the bone over time, okay? And that is called arthritis of the facet joints, okay? That's horrible. You can't see that. It's all good. Now, does arthritis equal pain? Well, just like we've talked about in previous videos, disc degeneration or degenerative disc disease does not necessarily equal pain. Similarly, degenerative joint disease or osteoarthritis does not necessarily equal pain. It is very common. Again, it's the body's reaction to its environment. So, why or how does a facet joint become painful? Well, if we put abnormal pressure into a joint that has arthritis, well, then it's easier for that joint to get inflamed or get irritated. Not only is it easier for that joint to get irritated or inflamed, it's easier for that joint to then get stuck in inflammation. So what do I mean by that? Well, that joint that's developing arthritis, there is some research in other joints specifically that shows that the local stem cells, the local healthy cells that live in that area actually decline as we get older with degenerative changes. And those local cells that live in that area, well, those are the guys that are in charge of reacting to inflammation when we do have that occur. Inflammation, remember, is actually the first part of the healing process. Inflammation is a normal thing that occurs when we get an injury, but that inflammation should come and should go. And it's your local environment in that joint that helps with regulating that process. But if that local environment is starting to get degenerated, it's not as healthy, then, well, it's easier for that inflammation to linger around when it occurs. So that's how a joint that has osteoarthritis can potentially become a pain generator. Now, there are other thought processes, other theories in terms of osteoarthritis and pain, but this is kind of a generalized view of why a joint that has arthritis can become painful. So I am going to actually show you an example of a joint that has arthritis here in the low back. So again, now this is a different view. This is not an X-ray. This is actually a CT scan, a CAT scan. And I'm going to point out some different things here. So let's see here. When we look at this, again, this is the bone, right? If you were here for my previous lectures, I talked about how this is kind of like a coffee mug, right, with water balloons in between. So here's the front of the mug, this is the back of the mug, the handle over here. And you can see the difference between this handle and the facet joints of the other one over there. You can see that it's starting to spike here. You can see these little divots that are forming inside. It's getting a lot more white, which is associated with some increased calcification here. All of this is that increased arthritis that's forming. Over here in this level here, you can see it actually kind of spiking into the circle where the nerves are exiting. So this is how the facet joint, even if the joint itself is not necessarily causing pain, some increased arthritis in that joint can cause narrowing of where the nerve is exiting. This narrowing of where the nerve is exiting is called stenosis. And here's an example of how degenerative changes in the facet joint here on the right side of the hole, and even some end plate changes associated with this disc degeneration that's occurring here can both contribute to narrowing of where this nerve is leaving. So what does that look like ultimately? When we see this space here, right, almost looks kind of like an oval, kind of plenty of room for the nerve to exit. And this is the nerve in cross section that's exiting right there. Whereas if you have the nerve here, you could see that the space has actually decreased substantially in comparison to the level above, almost looking like a keyhole there. That is being caused by the arthritis in that region. So two different ways that the joint that has arthritis can become an issue. Basically, when we have arthritis occurring, it's easier for that joint to get irritated or inflamed. And even if that does not occur, then it can start encroaching on or narrowing the space where the nerve is actually exiting, called stenosis. Now, does that need surgery, right? That's something that we've kind of been discussing in the past. When are these situations actually requiring surgery, and when are they situations where surgery can be avoided? Well, ultimately, there's no great surgery if we're just talking about pain associated with the facet joint arthritis. Surgery should be considered if there is significant stenosis that's occurring, and significantly narrowing the space where the nerve is traveling, and particularly if that is associated with nerve damage. If that's associated with the nerve being pinched, and significant symptoms such as weakness that are progressing despite conservative management, that's a situation where we may want to consider surgery for a situation like this. Now, there are non-surgical treatment options with facet joint arthritis. The first line treatment that I almost always recommend for patients with osteoarthritis of the facet joints is ultimately physical therapy, and strengthening the muscles around the core, because if we can strengthen the muscles around the spine, if we can then take pressure off of the low back, then that can alleviate some of the pressure off of the spine, off of the facet joints, and decrease the pain, right? Because if we can strengthen our muscles and then take pressure off, take pressure off of those facet joints, then that can alleviate a lot of the pain. There are anti-inflammatory medications that could be considered. We have to be careful about those. There are a lot of side effects associated with those, and the truth is that they may actually interfere with healing. Traditional treatments for facet joint arthritis, when there are continued symptoms despite proper physical therapy, exercise, etc., would include things like injections into the facet joints with corticosteroid. Steroid injection into the facet joint can decrease pain and inflammation, but we also have to realize the limitations. These should not be injected when we talk about patients that are younger, or having, if we only have a reduced amount of pain from facet joint cortisone injections for a short period of time, these should not be repeated, because we've seen in other joints that cortisone injections into joints can actually progress arthritis and make things worse. There's a type of treatment called a radiofrequency ablation that can be done for facet joint arthritis pain. That involves dulling the little nerves that go to the facet joints. So we have these little tiny nerves that go to those joints, and by putting a specialized needle directly at those nerves and essentially burning those nerves, sounds scary, and it is a little bit painful, but that can kind of deaden those nerves temporarily, and then we can have a decreased pain sensations from those facet joints. Now, it sounds great in theory, because we're basically cutting off the pain signal that's coming from those joints. The issue with that is, especially if this is something that is repeated, we run the potential risk of causing further issues. So what do I mean by that? This is something that's been controversial in the literature, but those little tiny nerves that go to the facet joints also go to the small little muscles of the low back called the multifidus muscles. And if we decrease the nerve signals coming from painful joints, we're also decreasing the nerve signals that are going to those small little muscles, and the theory is that can cause those muscles to not fire properly, which could then just lead to further worsening of the situation. Now, this has been debated in the research, but I have seen patients that have had repeated radiofrequency ablation to facet joints on one side, for example, and they demonstrated significant atrophy of those muscles on the same side as a radiofrequency ablation. So definitely something to consider. Now, the way I treat situations like this is, quite frankly, the facet joint to me is only a piece of the puzzle. Because, as we mentioned, there are all these different things that are involved, right? There's the disc, there's the facet joint, there are the ligaments that are connecting these bones together, there are the muscles between these joints. All of these things are a part of what's called the functional spinal unit. And by addressing all of the components of the functional spinal unit, we could try to, number one, calm down the inflammation or irritation of the joint, and perhaps even change the negative biology of the joint back to a neutral, happy environment. But also, number two, by addressing the different aspects of the functional spinal unit, can we provide some stability to the joint? Can we decrease some of that micro instability, that motion that's taking place, that is what's contributing to the facet joints getting irritated in the first place? Using these orthobiologic treatments to strengthen all the various aspects of the functional spinal unit, in combination with the appropriate exercise, physical therapy, in combination with the appropriate nutrition to make sure that we're not feeding any inflammation with what we eat, hitting things from all angles there, and we can actually get some pretty substantial benefit to pain associated with those facet joint arthritis. Some unpublished data, which is really interesting, from a colleague of mine, Dr. Chris Williams of Atlanta. He looked at patients that were treated with PRP injections into the facet joints versus patients that were treated with PRP injections into the facet joints and all the other components of the functional spinal unit. And this was not a randomized controlled trial. This was just looking at data. And by and large, the patients that had treatment of the whole functional spinal unit had improved and longer lasting results. So we've seen that anecdotally with my patients. Treating things comprehensively ends up better than treating things individually, and we can get some pretty darn good results overall. So I hope that all made sense. I hope that cleared up any confusion about arthritis in the low back. There's a lot of areas where we can get osteoarthritis, and the reality is that osteoarthritis does not necessarily equal pain. But when it does become a pain generator, it could either be the joint itself or the fact that the joint encroaches on things like the nerves by narrowing the space, what's called stenosis. There's a lot more that goes into this, but this was kind of a simplistic view of the whole picture. And ultimately, I want to make sure that you guys are learning the anatomy and understanding what's going on in your bodies. If you have any other topics that you want to discuss, please let me know. I've had some folks reach out to me and they want to discuss how to look at your own low back MRI. So I will be doing that coming up shortly, but I want to discuss a couple other topics, and then we'll go into actually being able to visualize your MRI yourself. So stay tuned, keep tuning in every week, and I will definitely be telling you everything that I got in my noggin in regards to your back. So I hope you enjoyed this. If you found this helpful, please like it, share it, send it to your friends, send it to your family, send it to your enemies, send it to everybody, because I think it's so important for us to understand what's going on in our bodies, and I hope this was helpful in those regards. That's really about it. See you guys next week. Have a happy Friday and a wonderful weekend.